Identify the client and explain the procedure. Client identification validates the correct patient and correct procedure. Discuss and explanation help allay anxiety and prepare the client for what to do. Perform hand washing and put on gloves if necessary. This to hand hygiene and gloving prevent the spread of microorganisms. Close the door or curtains. This is to provide clients privacy during the procedure. A. Assessing client to sitting position in bed. Adjust the bed at appropriate and comfortable working height. Proper bed height helps reduce back strain while you are performing the procedure. Place client flat on the bed or as low as the client can tolerate with the arm on the side and palms facing downward. This the flat position help to decrease the gravitational pull of the upper body. Place a pillow at the head of the patient and remove all other pillows. Removing pillows from under the client facilitate the placing pillow at the head of the bed prevents accidental head injury against the top of the bed. Ask the client if able to bend his or legs and put his or her feet flat on the bed to assist the movement. This the client can use major muscle group to push even if the client is too weak to push on the bed. Placing the legs is patient will assist with movement and prevent shearing of the skin on the heels. Position yourself at the client's midsection with your feet spread shoulder width apart of one foot slightly in the front of other. Doing such position opposite his center of the body mass lower the center of gravity and reduces the risk for injury. Place your arm at that nearest to the client's shoulders over the client's shoulders. Resting between the shoulder blades, place other hand near the edge of the bed by client's shoulder. This to facilitate easy, safe, and orderly steps in assisting client to a sitting position. Push the hand up by the edge of the bed and pull the client towards you. Assist lifting the client in sitting position. This to facilitate easy and safe and orderly steps in assisting client to sitting position. Assist the client to a comfortable position and adjust the pillows and support as needed. Raise the side rails, place the bed in the lowest position. Readjusting the bed with the support and side rails ensure client safety and comfort. Place the bed in the lowest position, raise the head of the bed slowly, as high as client can tolerate. Proper bed height and positioning facilitate an easy and safe changing of position into sitting position. Encourage the client to make us a standing assisting aid attached to the side of the bed. If able to move the side of the bed into a sideline position facing the side of the bed the client will sit on, turn on the client facing you, place the client's lower legs and feet on the edge of the bed. Encourage the independence reduces strain of the nerves and decrease the risk of the client injury. Stand near the client hips, stand with your legs and shoulder with one foot near the head of the bed, slightly in front of the other foot. The nerve center of gravity is placed near the client's greatest weight of the safety assessment of the client to the sitting position. Place one arm around the client's shoulder and other arm under the client's thigh near the knees. This is to facilitate easy and safe and orderly step in assisting client to sitting position. Encourage the client to make use of the stand assisting device, assisting the client to sit up on the side of the bed by lifting the client's thighs and gently turning the client on the edge of the bed. Keep your back straight and avoiding twisting. Gravity lowers the client's legs over the bed. The pulse transfer weight in the direction of and protects his or her back from injury. Let the client dangle his legs on the edge of the bed. This allows the circulatory system to adjust or to change in position. Make sure the bed brakes are locked by put the wheelchair next to the bed facing the foot of the bed. If available, lock the brakes of the chair. If the chair does not have brakes, brace the chair against the secure object. Looking for brakes or raising the chair prevents movement during the transfer and increases stability and client safety. Place the bed in the lowest position. Raise the head of the bed to the sitting position or the high as the client can tolerate. Lower the side rails. This the proper bed height and positioning facilitate the transfer. Assist the client in the side lying position, facing the side of the bed where the chair is. Encourage the independence, reduces the strain for the nurse and decrease risk of the client injury. Stand with the legs apart with one foot forward near the head of the bed. This the nurse center of gravity is placed near the client's greatest weight to safely assess the client to the sitting position. Assist the client in sitting the edge of the bed. Let the legs dangle for a few minutes. This the sitting position facilitates the transfer to the clients and allows the circulatory system to adjust the change in position. Stand facing the client. Spread your feet about shoulder width apart and flex your hips and knees. This position provides stability and allows the smooth movement using the legs' large muscle groups. Position yourself as close as possible to the client with your foot positioned on the outside of the client's foot. Doing this provides balance and support.
Waist.
Put your hand around the client's waist. Place the client's one hand on your shoulder and other hand on your waist. Holding the guilt belt prevents injury to the client. Ask the client to slide his buttocks to the edge of the bed until the feet touch the floor. These two actions facilitate easy and safe transfer of the client from bed to wheelchair. On the count of 3, use your legs, not your back, to help raise the client to the standing position. Turn the client with his back to the chair. This action facilitates easy and safe transfer to the client bed to wheelchair. If I indicate, brace your front knee against the client weak extremely as he or she standing prevent from bucking on failing. Ask the client to walk backwards until they feel the chair with the back of his legs. Ensure proper positioning before sitting. Tell the client to grasp the arm of the chair and gently lower the client into the chair. Flex your hips and knees when helping the client sit in the chair. This is to flexing the hips and knees uses major muscles groups to aid movement and reduce strain the nerve's back. Place feet on the foot raise of the wheelchair. Make sure client comfortable and drape if necessary. Adjust the head of the bed to the flat position or as low as the client can tolerate. Proper positioning facilitates the transfer. Raise the bed on the height 1/2 inch higher than the transport stretcher. Lower the side rails if in place. Proper hand height and lowering the side of rails makes transfer easier and decrease the risk of injury. Loosen the draw sheet or place a lifter under the client's. Roll the sheet close to the client's body. A draw sheet supports the client's weight and reduce the friction during the lift. Provides the secure hold and lifter board makes it easier to move the client and minimize the risk of injury to the client and nurses. Position the stretcher next to the parallel to the bed. Lock the wheels on the stretcher and the bed. This positioning equipment makes the transfer easier and decrease the risk of injury. Locking the wheels keeps the bed and stretcher from the moving. Have the client fold arms against the chest and move chin to chest. This position facilitates safe and transfer of the client from the bed to stretcher. Let the assistant stand across the middle of the stretcher and grasp the other rolled end over the sheet of the client's head part and lower hip area. Doing this support head, upper and lower parts of the client's body. Climb into the mattress beside hips and buttocks on the client. Grasp the rolled sheet and shoulder part of hip area of the client. This will facilitate easy and safe and comfortable transfer of the client from bed to stretcher. The count of three, let the nurse standing on the stretcher side of the bed. Put the sheet while the nursing nail on the bed should lift the draw sheet, transferring the client weight towards the transfer board and pushing the client from bed to stretcher. This working incision distribute with the moving client and facilitate the transfer. Remove the transfer board if used. Then the raised side rails of the stretcher transfer the IVF to the IV pole of the stretcher. This to ensure client safety. Place the client comfortable in stretcher and drape properly. Blanket promotes comfort and warmth and privacy. Remove gloves and perform hand washing. This to prevent the spread of microorganisms.